Hi, this is Dr. Scott Hoar, and today is Treatment Tuesday, and this week our patient is Dr. Susan Fidler. Dr. Fidler, what would you call it?
I'm a herbalist, but I'm also a naturopath.
Okay. Her practice, Riverdale Herbs. What are we saying these days?
It's Herbs in
Herbs.
England. Yeah.
Riverdale Herbs is on Broadway in Maryville, Tennessee. What's an example of your typical patient that comes to see you?
Typical patients, high stress. And that can express itself in diminished immune response. Lowered immune system is huge, and I'm seeing a lot of autoimmune issues with clients.
Okay.
A lot of digestive issues. And so we do work a lot on diet and how well they're digesting their food.
And then what kind of intervention do you put in place typically?
Well, we do talk about diet and lifestyle, and I do test them to see what kind of diet is appropriate for them. One thing that helps almost everybody are bitter herbs, because there are bitter receptors in every tissue, well, not every tissue, but most tissues of the body, including lungs, brain. We think of bitter herbs as being hard on the mouth.
Yes.
But they actually stimulate receptors in the gut, and they're enormously important with respiratory distress. There are bitter receptors even in the lungs. So giving bitter herbs can be enormously effective and reduce the number of other supplements that they actually need.
Activating that bitter response, does something like black coffee activate that at all?
It can do, but of course it's also going to open sphincters. So if they have reflux, it's going to make that worse. Okay. It's going to make bowel movements easier.
Yeah.
But you might have unwanted responses as well.
Sure.
So I will choose herbs that are going to actually help the production of hydrochloric acid and get it going in the right direction. So by giving the bitter herbs, it enables your body to recover.
Okay. Okay, that's pretty interesting. I just had a question that left me.
We work on that too.
You remember me?
Word finding.
Good.
Circulation to the brain.
Definitely need more of that.
Neurotransmitter production. 75 to 95% of serotonin production occurs in the gut. So if the gut's not happy, I can't do the East Tennessee thing, but ain't nobody happy, you know. If the gut's not happy, you're not going to be producing serotonin and other neurotransmitters that will affect brain function.
So Dr. Fidler has been a patient of ours for some time now, so we do have established exams and x-rays and everything like that on her. But Dr. Susan, why don't you tell us, what are you dealing with today?
I'm really still dealing with the outcome of a bad fall in May when I broke my distal fibula on the left and sprained both ankles.
Right.
So the bone recovery has been very easy. The soft tissue has been another matter.
Okay.
My left foot was swelling so frequently that it was very difficult for me to walk normally and to do any exercises, and with those adjustments I've been able to do that. I very rarely get swelling now.
Great. Okay, so we went over Dr. Fidler's old x-rays and we saw a number of lateral curvatures throughout her thorax as well as lumbar spines. Little bit of degenerative changes in the neck, but those x-rays are a couple of years old, and she's mentioned, she's been taking specific herbs to deal with calcifications and actually reducing some degenerative changes. So that would be an interesting thing for us to check out. On her movement assessment, her rotation to the one side, going to the right, was a little bit limited. Minor limitations in neck and shoulder movements that we will address here today. But probably the big thing was she shared with me that going downstairs are very uncomfortable, specifically in her feet and ankles. She did have that ankle fracture that she had, what did you say, June?
May, I think.
In May of this year, and she's continuing to be recovering from that. So we're going to address that and see if we can't make it any easier for her to go down the stairs today. So we start off with some motion palpation. I'm just putting motion into the different segments of your spine, and I'm looking for any restrictions in any of the segments. We want to see if we can't help out. On that right side, right there.
Yes.
You feel it, huh? Yeah, there's some limitations. This is about C3, maybe C4 over here. So we'll put you right over here, and I will give you a little adjustment, okay? Very good. Some nice motion in there. How you doing?
Okay.
And going in there to reassess. I love that motion right there. That's a little bit better. Can you tell a difference there?
Yes.
All right, good. All right. And your lower neck on the left side, a little bit of a restriction there, so we'll put some motion in here. Good. Okay. Now, let's see here, the shoulder. I'm going to push down.
Okay.
Resist that motion. Ready? Very strong. No irritation, right?
No.
Thumb and pinky, put them together like that. I'm going to pull them apart. Again. Little weak there, huh?
Right.
All right. So that muscle test is influenced by your nerve roots, about C8 and T1. So we'll come down here a little bit. And on the feel, I'm not crazy about it, so let me feel the other side of it. A little bit more restricted over here, so I'll adjust this segment. Good. Thumb and pinky, pulling apart.
Good.
Beautiful. Elbow in at your rib cage. I'm going to pull it out here towards me. Resist that. That was a little weak, wasn't it?
Yes.
All right. We're going to. Can you put your right palm on your ear? I'm going to stick my one thumb in your armpit, wrap my hand around your shoulder blade here. We're going to adjust your ribs underneath your shoulder blade. Relax your elbow. Good. Take a deep breath for me and breathe on out. Very good. Okay, you all right?
Yep.
Elbow in. I'm going to pull out. Don't let me.
Oh, good.
There we go. Beautiful.
Good.
Stiffness right here. Put your chin to your chest. Keep your hands firm on your body. That's good. This table's a little soft. Okay. Good. A little bit stiff with that left hip there. Okay, so with hip flexibility, we always want to make sure that both your lumbar spine and your hips are moving as well as possible in support of your lower extremities here. And looking at your internal rotation, number one, what do you feel here?
I feel tightness here.
Some tightness and restriction. And I'm seeing a limited range of motion for sure. So I want to address that. So the first thing I'll do is start with a little bit of it's actually a capsular mobilization deep in the hip, where I'm doing a distractive force with both my right elbow and then my hand here. And you feel like it's probably darn near going to pop out, right?
Yeah.
Yeah.
Feels weird.
Yeah. Good. And now the range is a little bit more. You could tell there's still some restriction within the area. So doc, the reason chiropractic tables drop and pop and stuff is so that we can be a little bit more aggressive in our manipulation, and the drop accepts the excessive force from the area. So it feels less like I'm punching your hip here and more like an adjustment. So this is called a speeder board. So I'm going to put it directly under your hip, and then we go right into that internal rotation, and then I find the most restricted angle, which is about right there, and we're going to drop right into it. And I'll do it one more time for good measure. And that's already cleaned up, actually, nicely. Good. And Much better range, less compensation from it. Probably not perfect, but a little bit better, yeah?
Yeah,
Good. Well, yeah, right now, your range of motion with your right hip seems pretty good. I'm going to do a muscle test where I push down.
Okay.
Don't let me do that. Ready? Go. Ah!
You already did the test, you didn't know you did.
Pushing down. Don't let me. And again, that's not wonderful either. Let's check some other stuff out. Hold your leg right there. I'm going to push down and out. Resist that. That's pretty darn strong. Down and out. Resist that. That, again, that wasn't strong with it. So turn on your side. Face this way. All right. Breathe out. Very good. And lay on your back. Hold it right there. Pushing down and out. Much better. Okay, I'm going to push down and in. Resist that. That was a little weak. Down and in, resist that. That was a little weak. Let's go back to your hip flexors. Hold it right there. I'm going to push down, resist that. And that's much stronger now that we got the L3. Good. So why don't you just flip around on your belly. I'm going to straighten your leg, resist that motion. Very strong. Pushing down. Very strong. Raise your knee up. I'm going to push your knee to the table. That's very strong. Knee up, pushing down. And that's the weak one, isn't it? So turn on your side. Face me. Same direction. All right. Take a deep breath. Breathe out. Good. And face down. Bring your knee up. Hold it right there. Pushing down. Lovely. Okay, so now we are supporting your feet a little bit better because all the nerves right here are tuned up. All right. So the first thing we noticed is the toe extension of this right foot is certainly limited. And it's not surprising you see this hypertrophy of the bone in her foot and her big toe. It's actually growing out, so that's degeneration. That's a little bit of arthritis because this joint has been so beaten up that the body throws excessive calcium at it and it actually starts growing a little bit. And that growth isn't helping the range of motion of her ankle. So we are not going to be able to fix that instantly, but what we can do is open up the capsule of that joint and see if we can get 2, maybe 3, maybe 4 degrees of improvement to, number one, improve her overall flexibility, which will make foot movement easier, and then also just get to the point where those degenerative changes aren't continuing. And that's probably pretty tender. Yes, Doc?
It's not too bad at the moment.
Not too bad? Well, I'll do it harder then. All right, I'm going to do a little adjustment right here to the arch of her foot. That feels a little locked up to me, so I'll give her a little yank here. Good. And already that dorsiflexion is really opening up. Even though the joint I adjusted was right here, but we noticed an instant release in actually the ankle's ability to dorsiflex, which is always pretty cool. I'm going to look at the cuboid here. Good. All right, let's do some muscle tests. Foot up and out. Hold it right there. I'm going to push from right there. Resist that. Very strong. Point and out. Push from right there. Resist that. Very strong. Up and in. Hold it from right there. Push from right here. Not so strong. Point and in. Hold it right here. I'm going to push from right here. And that's not so strong either. So we're certainly noticing weakness in some of the muscles on the inside of her leg and foot. So I'll see what I can do to help out with that. I think the first thing I'm going to look at is just a tailor, a sub-tailor adjustment right underneath. So I'm going to give you a yank, Doc. Good. And let's see if that made the difference that we're looking to make. Up and in. Hold it right there. I'm going to push from right here. It's stronger, but it's not strong. Point and in. Hold it right there. Push from here. And that's definitely stronger. Good. So now that ankle dorsiflexion, look at all of that range of motion that we're seeing. That is much better. The toe is starting to open up a little bit. I'm going to look at some of the other phalanges here. It's pretty good. I like her. We'll do one eversion adjustment here. Good. Up and in. Hold it right there. Push from right here. And boom. Now it's rock solid, huh?
Yeah. Much more comfortable.
Switch feet. Okay. And look at this toe. So I would actually say this is limited toe extension as well, but it's so much better than we're seeing on her other foot. And that's probably why she doesn't have the big growth like she does on the other side.
Well, I injured this one.
How'd you injure it?
Jammed it into a concrete corner. Jammed it into the right angle.
That'll do it.
And I also broke the second toe.
This guy.
No, on the right.
Oh, well, okay. Did you break this second toe?
No, I jammed that one in the swimming pool doing my exercises for my broken leg.
And when exactly was that, though?
Oh, that was July. It doesn't feel right.
Yeah. You could see there's some extra hard hypertrophy, bony hypertrophy in the joint right here, which is where she injured it. And that's why she's saying it doesn't feel normal. And with some of her prior treatments, we've actually seen some swelling and discoloration of this toe here. So we want to see if we can't encourage proper motion and proper blood flow and drainage from the area.
Yes. Yes, please.
Dorsiflexion on this ankle is not terrible, tell you what, but I'm sure we'll be able to improve it a little bit. I'm going to do another arch adjustment here. Good. All right, let's do some muscle tests. Up and in, hold it right there, push from right here. Very strong, pointing and in, hold it right there, push from right there. Pretty good. Up and out, hold it from right there and push from right here. Pretty good, pointing and out, hold it from right there, I'm going to point from right there. And that was definitely strong. So the big thing I'm feeling here is your foot's ability to evert through the heel is just a little bit limited. So I'm going to just do a quick adjustment, the pound adjustment. And then that opens up the eversion a little bit, foot up and out, hold it from right there. I'm going to push from right there. Pretty good. I'll give you a subtalar adjustment. Good.
I felt that up here.
Yeah, up and out, hold it from right there, push from right there. Good. All right. I like it. So let's get you a couple of exercises. Raise your butt up off the floor and down. Any pain, stiffness, discomfort. Other side. And down.
No.
No. Good. Now, let's check something, okay? The job of your hips and your core is to have stability and control. So what I'm going to do in a second to check and see if you have the control we want is I'm going to have you raise your butt up off the floor. You're going to, not yet. You're going to hold it up just like that, though. And you're already cramped. Uh-huh. Did it go away?
Yes.
All right. Well, I think we already know what the answer is going to be. So you're going to raise your butt up, and then I'm going to bully you around, or what we call a perturbation. And there's one of two outcomes that's going to happen. Either number one, you have great core control and stability, and it looks like this. Or number two, I push you, and it goes like this, and you're going to spaz out your hamstring.
Okay.
So let's see how... So hold it up right there. And the slightest breeze blows you right over. All right, let's see if we can do something about that.
Okay.
Number one, I want you to raise your toes up off the ground. Good. A little bit more. So you're just pushing through your heel.
Ah.
Number two, I'm going to do this. I'm going to push your knee from out to in.
Oh.
And I want you to just resist that. Keep resisting it. And now raise your butt up off the floor. That's pretty tough. So let's try it again, kind of reset.
Okay. Yes.
Not so much. Let's try something else. Keep the foot as is. Yeah, you can just relax that. I'm going to push your arm. I want you to resist that. No, hold on. Don't worry about this yet. Just engage here. Perfect. Now raise your butt up off the floor. Hold it. And that's stability, isn't it?
Yes.
Good. We're going to bring stability to your right shoulder and shoulder girdle. And that allows your left hip to fire in a way that's a little bit more stable for you. Cramping again.
Yeah.
Did you have the toes up?
Yes.
You did? Okay, good. Let's try it again. Squeeze hard. And down. And up. You can just rest your hand on your belly if you want. And down.
Wow. That's really different.
The first exercise we did was the single leg glute bridge,
Yes.
where you're raising your butt up and we were checking your stability. What was that like for you?
Initially I thought, oh, piece of cake, no problem here. And then when you checked my stability, it was not there.
Yeah, we see that all the
Wasn't
time.
there.
But then we were able to find a correction where
Yes.
once you pre-activated the one shoulder, that actually brought stability to your
Yes.
system. So I would recommend you do that exercise on your own.
Yes.
Left hip to fire with just way more stability and control of your spine and core and pelvis. My definition of stability is the elimination of inappropriate motion.
Yes.
In this exercise, gravity is going to force your hips and your spine and pelvis and knees and foot this way, and you're not allowing it.
Right.
So pop your pelvis up, reach your right hand up towards the ceiling. There is an inherent fear factor for many people, especially in recovering from injuries, of, oh, I don't want to lift things, I don't want to do heavy weight. And I spit right in the face of that. Because I want you to be strong, I want you to be confident, so we're going to throw weights in your hand to turn on stabilizing factors, strength, muscle, all that sort of stuff. What you'll notice is, with this weight being right here, it's pulling your body this way.
Yes.
So you inherently have to activate all sorts of stabilizers on that side.
Right.
Stay centered with your, try not to do the penguin walk. Okay, and go for it. And come on out of it. And again. Go as far as you can.
Okay.
You see the heel is staying on the ground and back. And it's just a bounce. It's kind of a self-mobilization we're doing. And back. Maybe 3 or 4 more. Perfect. Switch. And same thing. Well, we're going to do both. But you're just going to keep the weight in that hand. We finally put it all together with step down from a stair.
Yes.
Where we had the weight in the one hand to activate your lateral stabilizers, and then really the idea is focusing on the dorsiflexion of the ankle as you go down the stairs. What was that like for you?
I was a bit timid at first.
Yes.
So that was very interesting, and to see how that began to abate the more I did it. So that was very encouraging.
Yeah.
Actually.
I think that exercise is going to go so much smoother for you going just down a flight of stairs
Yes.
versus the one step and getting back up. It was like starting and stopping, where you could have just put a bunch of reps together
Right.
in a row to really groove that pattern. But I think that'd be a great exercise for you to do at home.
Yeah.
To do. But from what I can see, you're grooving this pattern. It's
Yes.
getting more comfortable.
Yes.
You're becoming more confident in your ability to do it. You're having more stability and resilience in
Yeah.
this movement pattern, which is your movement that we're not so comfortable
Good.
with. Okay, so that's our treatment.
Yes.
Dr. Fidler, how was that for you?
That's very encouraging.
Yeah?
Yeah.
Why?
Feel like I have some more tools to get on top of things and to improve stability and go forward and make progress towards healing. And at least with the joints here, if we can arrest further degeneration, that would be really good. Yes.
Dr. Fidler, thank you so much for being a great guest for us today. Thank you so much for tuning in. This was Treatment Tuesday. I'm Dr. Scott Hoar. Don't forget to hit the subscribe button, leave a comment below, hit the like button, and tune in next week for Treatment Tuesday. Bye-bye.